Yeah, so thanks everybody for being here. I'm Betsy, one of the co-founders and editors of the Sick Times. And we're really excited to be, a few weeks now into our soft launch, our newsletter, and just to hear from you all about how you think we're doing so far and any kind of story ideas that you have. Miles, anything you want to add?
Oh, that's great.
Cool. Yeah, so you probably all know this if you're here, but just to give the quick intro. So we're a nonprofit news site covering the long COVID crisis with a real goal of providing what some of us as journalists call service journalism, which means like we want what we're doing to be really useful for you all, whether you're in the long COVID community or you're an ally or whatever your kind of position there might be. We want the coverage to be helpful and to be sort of actionable if maybe it's like studies that you could bring to a doctor or giving giving updates on advocacy actions that people can take in response to a particular issue. A lot of that is kind of what we're focused on. Also, in addition to long COVID, we plan to cover related infection-associated chronic conditions. So that's like ME/CFS, dysautonomia, mast cell activation syndrome, EDS, and all these other kind of conditions that fall under the same sphere as long COVID, and where there's a lot to maybe learn from the research and from the past symptom management strategies and experiences of folks in those communities that kind of can inform long COVID. In addition to that, we're going to be covering the kind of acute COVID crisis, which, regardless of what Joe Biden might say, the pandemic is not over. So we're going to cover it accordingly with, data updates and updates on kind of what's going on with the acute coronavirus and also related issues with public health. So things like surveillance systems, health equity issues as it relates to, new viral outbreaks and things of that nature. Just to introduce ourselves a little bit. So like I said, I'm Betsy. I'm a freelance science, health, and data journalist based in New York City. It's very dark outside, which is a bummer, even though it's 7 p.m. Prior to the Sick Times, I wrote the COVID Data Dispatch, which was a blog and newsletter focused on COVID data, as you could guess from the name. So I did that for over 3 years and got a lot of experience in, writing a regular newsletter and also being kind of responsive to people who are interested in continued coverage of this crisis. I also, for a while, was a journalism fellow at Muckrock, which is a nonprofit site that makes it easy for people to file and learn about public records, and also has a newsroom attached to it that does investigative and accountability journalism. And I did a lot of COVID coverage for them. Which also is informing our work at the Sick Times. Muckrock also is now our fiscal sponsor, so that organization is a big supporter of this. I've also volunteered for the COVID tracking project, and I've written stories about COVID and related public health issues for national news outlets, as well as a couple here in New York City. Miles.
Great. Thanks for coming, everyone. My name is Miles Griffis. I'm also one of the co-founders and editors of the Sick Times. And yeah, I have been covering sort of long COVID since 2020, when I first got sick with it, about February of 2020. I was a journalist prior to that. So it's been nice that this has been a really nice outlet for me to continue doing work that I was already passionate about, and then, discovering a topic that personally affects me and that I deal with every day. So I've written for a lot of national and local publications, and I'm really excited to, finally sort of have the opportunity to work with Betsy and really dig into the stories that we've been wanting to tell, have been held back from telling, all these different things. So we're quite excited, and we're happy that you're all here.
Yeah, so just to give an idea of the kind of coverage areas that we're thinking about at this point. So the first big one is science, which basically means covering new research, trends in research. So that could be both like keeping folks updated on new papers as they're coming out, and also trying to take a longer view and looking at like the search for biomarkers, for example. Like, could we do maybe a longer piece about kind of where that's at and what the research is showing at this point? Another main area is health, so that's like healthcare issues, quality of life issues, and then intersecting with that is policy, so covering federal agencies like the CDC, the NIH, HHS, hopefully FDA once we have treatments that are under review eventually. The FDA will probably be a bigger one to cover later. Also looking at advocacy efforts and how then, like I mentioned before, we're going to keep covering the acute COVID pandemic. So anyone who's followed the COVID data dispatch probably knows that I've been doing weekly COVID data updates for a long time. I know where to find information. I know how to kind of keep track of trends, and that was something that I wanted to bring to the Sick Times, since I know that many people in the community are interested in kind of keeping up to date with where we're at with COVID, and also knowing where to find data, maybe for their specific communities. So that's another thing we'll be doing, just with kind of those weekly updates. Um, we also really want to do investigative and accountability reporting, which I think Miles and I both feel has been kind of missing from long COVID coverage, in terms of really trying to find out like what are the institutions, what are the powerful people who we can hold responsible for different facets of this crisis, whether it's groups that might be like bankrolling misinformation, or who's behind some trial that appears to not be well founded in scientific evidence, that sort of thing. And then also that also applies to coverage of public agencies. And then we're going to be publishing commentary. So that means like op-eds, personal essays from researchers, advocates, or anybody in the long COVID community who would like to write something about their experience. And then later on, once we have a budget for it, we really want to do international stories, because long COVID is very undercovered on the global scale. And so we want to be able to work with freelancers in different parts of the world to help them kind of tell stories about their community. Miles, do you want to mention some stories we have coming up?
Yeah, so we have sort of an editorial schedule for our newsletters for the next month, few weeks. The first big one is sort of Betsy continuing a lot of the work that she's done on recover. So she's gotten some great public records requests back. So she's been looking through those. So we're really looking forward to that, because that's been such an important story that that Betsy's been leading for the past 2 year plus, really. We have some new stuff coming out on some long COVID clinics, which were granted I guess like more, what was it, Betsy? It's more funding, is that right?
Yeah, so the grants were a total of $45 million to 9 clinics across the country. And they're going to be funded for, at this point, I think it's 4 to 5 years, and then could be like renewed or extended further, to basically help these clinics expand access to healthcare for long COVID. And also another goal is like developing best practices, particularly that can be shared with primary care doctors. So I've been doing interviews with leaders at a bunch of the clinics, and I'm going to share kind of what they're working on, and what they plan to do with this decent grant, not really on the same level as Recover, but still like a pretty significant federal program. Yeah, and then some of the other things you see on this slide are just ideas that we have, that are sort of on our top priority list for the next few weeks. But we also want to hear from all of you about what you think our kind of priorities should be. Yeah, another thing that we are thinking about and starting to work on is partnerships with other news outlets. So as I mentioned, Muckrock, which is our physical sponsor, has been kind of a pioneer of this model of collaborative journalism, which essentially means rather than one news outlet working on a story, you have two or more outlets working together, and often doing so in a way that's kind of complementary. So a lot of the stories that I worked on when I was a fellow there involved the Muckrock team, editorial team sort of serving as an expert team on like data and investigative skills, and then working with local reporters who really knew their community well and could be doing like on the ground reporting. And so I think that's a model that we would love to replicate in terms of Miles and I bringing our expertise on long COVID to particularly local news outlets, because we know, there are long COVID stories everywhere, but it's coverage that doesn't really happen too often. So we would love to be able to sort of help local news outlets just start to tell those stories. And working with national outlets as well to help like expand our reach as a publication, and similarly to help kind of improve coverage of this topic. Also, be interested in collaborating with researchers or with other groups that are studying long COVID or working on communication around it. So if you happen to know of anybody who might be interested or who might be working on something and would want to collaborate with us, please reach out. We're in sort of early discussion stages on like a couple of these right now. But yeah, definitely very excited about this potential.
Yeah, so the next sort of thing we're working on, we really want to make this site and project very accessible to people living with this condition and others. We're never going to have a paywall. And as we get more funding, we're hoping to add more features that'll make it more accessible. So for our bigger features, we hope to have audio stories so you can listen to them, as we know that is helpful for some people, rather than reading. That can be quite a bigger task cognitively. So we'd like to be able to offer that once we have more resources. We would also like to have sort of like a weekly podcast that would give, maybe it's 5 to 10 minutes long and kind of give you the updates of what we found on our site. So this would make it more accessible for people who can't, read all these different things or follow along on all these different social media platforms. So we're hoping that it'd be a nice, concise way for people just to get updated on what's happening and what we've been reporting on. We have other ideas for podcasts too. Again, with the more funding we get, we'll be able to hire people who have more experience in that. Betsy and I are not podcasters, so we're hoping to bring on other people who could really help make podcasts shine on the sick times. And yeah, so once we get to sort of the town hall aspect of this, we really want to hear what you would find most helpful from the site. We've had our reader survey going for a couple of weeks, so we have some more ideas, but we'd love to hear what would be best for you as we sort of keep forming this site and experimenting.
Oh, I went the wrong way. Okay, there we go. Yeah, so as folks might have known from our recent newsletters, we are trying to raise money in order to basically pay ourselves and then also pay other people to come and join this project. So our current funding goal is $75,000 that would support about 6 months of our work, and also a freelance budget to start paying other contributors. We also have grant applications out right now that would be for much higher amounts, to potentially support the same things I was talking about, really Miles and I paying ourselves, bringing on other part-time contributors, and paying freelancers, particularly trying to expand internationally, as I mentioned. So that's kind of where we're at the moment. Any funding that, or any donations that folks reading the site directly can provide are really helpful, because it's sort of, as someone who has been involved with this like nonprofit media ecosystem for a few years now, one thing I've learned is that these different sources of funding can kind of feed into each other. Like if you can go to a grant funder and say, hey, we've had this amount of readers, donate to us because they believe in our coverage, then that can help to sort of demonstrate to a larger grant, like nonprofit or philanthropy organization, that this is a project worth supporting. So these things really kind of feed into each other. And we would love for folks to, share what we're doing. If your friends and family members are asking like what they can do to support people with long COVID right now, this project, and of course many others as well, that this might be one option that you could send them. Yeah, Miles, anything else you want to add on this? You're muted.
No, just that we're really looking forward to hearing back from some of these grants that we've applied for. We're going to keep looking for them. We really don't want the burden to be on our readers, so we're really trying everything we can to outsource and find funding, because we truly believe that if the world is going to abandon COVID and long COVID, they should be paying for the journalism that is talking about it. There's just so much opportunity, and I think grants out there that we can tap. So we're going to keep trying.
Yeah.
Going forward.
Suggestions are very helpful or very welcome for that too, if you happen to have any ideas. Yeah, so now we would love to hear from all of you about, what you want us to cover, any ideas that you have.